Thank you, Mr. Chairman. I'd like to thank the SSCP for having this hearing, and I'd also like to thank all of the witnesses for testifying before the Select Subcommittee today. First, let me just say, for those who don't know me, I'm a physician, was a nurse prior to being a physician, was also the director of the Iowa Department of Public Health, and a 24-year military veteran. So I have a lot of experience in all facets of medicine. The COVID-19 pandemic dramatically altered many aspects of healthcare. As we know, hospitals and clinics were closed, even though in the healthcare setting, we know how to manage infectious diseases. But most notably, I think what we saw was a further erosion of the doctor-patient relationship. So as a physician and a nurse with decades of experience delivering care to patients of all ages and in various healthcare settings, I recognize the value and the reality that patient medical needs can rarely, if ever, be broad-brushed. Individual needs vary drastically. These can be due to allergies, comorbidities, intolerances, various other medical factors or social factors that require a robust doctor-patient relationship. And this is something that all doctors, including my friends and physician colleagues on the other side of the aisle, publicly recognize. And let's also admit, as Dr. Winstrup did at the start of this hearing, that there have been decades of erosion of the doctor-patient relationship, from pre-authorization, step therapy, fail-first therapies, even when things have already been tried, even how EHRs and standardized practices geared towards billing rather than towards actual patient assessment and care. The use of off-label medicines. Never before have we had governors threaten the medical licenses of individuals if through their interactions and their medical knowledge were to prescribe a patient a certain type of medication, or boards of pharmacies to be told that those certificates would be removed. I was and am still appalled by the multitude of COVID-19 vaccine mandates imposed by federal, state, and local governments throughout the pandemic for exactly this reason. And I would disagree with our witness, who said that there were lots of opportunities. There were not lots of opportunities. If you were in the healthcare setting, despite over a year of having provided care to patients with PPE, you were mandated to get a vaccine or lose your job. I know of people who lost their job. If you were in the military, you were required to get a vaccine, even if you were 18 or 20 years old, even if you had your risk for getting myocarditis or pericarditis may have in fact been greater than your risk of being hospitalized or dying of COVID-19. We did not recognize infection-acquired immunity, which we have in every other type of infectious disease, but not in this one. Somehow, it just evaporated when it came to COVID-19. And in our school systems, you couldn't go to school as a child if you weren't vaccinated. So excuse me if I do not believe that the doctor-patient relationship and the doctor's conversations with individuals may have said you're at low risk or getting vaccinated or you've had COVID-19. I had the same experience as Dr. Winstrup. I was vaccinated. I gave vaccines in the 24 counties in my district. Recommended for people to be vaccinated and have conversations with their provider. But nonetheless, when I was testing my antibody levels and keeping track of them because of some research that said you may decrease antibody levels with boosters, my antibody levels were high, but even last December was still recommended to get the vaccine, to get a booster. So I'm not going to continue to pontificate, although we could go on for quite a while. Dr. Williams, in your written testimony, you detail how you developed your own treatment protocol for COVID patients during the pandemic. And let's remember that COVID patients were told if they tested positive, come back when you're really sick and you might die first before you come back in. So there were no treatment protocols offered to these individuals. So your protocols resulted in 5 hospitalizations, 0 deaths, despite seeing over 5,500 patients. Can you detail why this approach was effective and whether your practice would have benefited from increased government presence?
Thank you, ma'am, for the question. I took what I was trained to do and I applied it because we didn't have any options at that point at the beginning of the pandemic. And I dove into the research and I found what I could find, but we all agree it was an incomplete database. And there's the old saying, I cannot argue with anecdotal evidence, but that was all we had. That was all we had. But then we do what we do. We practice medicine and we observe and we adjust and we learn, and most importantly, sometimes we unlearn. And I was pro-vaccine. I was as anxious, and I was one of the first people to get the vaccine in my county at the behest of our county health official who called me directly because my name wasn't on the list. And I said, no, in the Marine Corps, the drill sergeant goes last. He eats last. His troops eat first. I'll go last. And he said, I need you to rethink that for me. I need you to go first because there's some trepidation. And I gladly went first. I'm twice vaccinated and once boosted. But when they started refusing to acknowledge natural immunity post-infection, it was a red flag for me. And I've always maintained, and I've made this very public, that it's an individual decision between the patient and their medical care provider. My protocols took a broad stroke approach at this virus. It's almost like peeling an onion. There's multiple layers. And so we were trying to attack the virus to kill the virus using virucidal whatever we had that we felt like was safe, first do no harm. But I was also looking at, with the cytokine storm, what was killing the patients in the hospital. So the inflammatory response to this virus is something that we needed to talk about more, we needed to address. So we used, amazingly, some very simple over-the-counter medications that stabilize the mast cell and the neutrophil. These are cells in our body that control that inflammatory response. And we're talking about things like Claritin, loratadine, famotidine, Pepcid AC, these kinds of drugs. And the supplement, melatonin, is a strong mast cell stabilizer. So we were working hard to stabilize these patients' mast cells. My goal, owning an urgent care company, was I had to address these patients that showed at my door frightened. And some of them were very, very sick and did not want to go to the hospital. And my goal was to save each patient that came through the door and to address this virus from every direction that I could.
Thank you, Dr. Williams. I hope others will allow you to expand on your testimony.